Doctor, usually what I feel is that the couples, if the pregnancy is not planned, or if they have not thought of conceiving a baby, and suddenly they get the news, so their mental intention at that time, their mental preparation at that time is not balanced. So, like, obviously that can affect the fetus again. What counseling can you give to such parents?
Yeah, I actually, by this time around 4th, 5th month, generally the couples are very settled with the pregnancy. Because now is the time that after 5th month, they can actually start to bond at this physical level also, as we just shared. By this time, they're more or less clear, accepted, restful with the fact. But I do see about, I would say 5% patients who are still not in sync with the pregnancy till date. So that I think is, and we do see, there is no huge study which has been done to document that what this stress and anxiety which they've had till this month, or they are going to continue till 6-7 months, what it is going to lead to. But the scientific facts are very clear that they are going to increase the complication rate in pregnancy. It is going to actually lead on to low birth weight infants. It is going to lead on to premature birth. So the rate of prematurity is very high in such patients. It is definitely going to make their labors and labor and delivery also more difficult, because you are not accepting right now. You're still fighting within themselves. So automatically
the feeling of unwanted is also there in the fetus. And
yeah, of course. At the psychological level, fetal psychology definitely states it that this type of pregnancies they actually develop into, they have some developmental defects which may continue in your adult life also. Because as we see, the blueprint is formed. No? So whatever you're feeding in right now is actually forming not just the emotional intelligence but also the lifetime health.
Yeah.
Overall personality, lifetime health of the child, I would say. So definitely this intention has to be very, very clear, and counseling is very, very necessary. If you feel, if any of us feels that even by this 4th, 5th month the pregnancy they have not accepted, this can actually, now just at an emotional level it will not harm the baby, it is actually going to harm the baby even at a physical level. So we do send the patients, expectant mothers or parents for counseling by a psychologist, psychiatrist. Mental health expert is really, really necessary in such cases if we feel we cannot handle it on our own. But that intention, if it's there before you're planning, you're clear, it really is a very, very good boost for the overall health of the mother and the baby both. So it definitely makes this journey smoother, happier, safer. So that is the importance of having a clear intention, a pure connect before you even start to plan a pregnancy. Yes, that I am waiting for you to come into my life.
Right. So it's just like that. If we say that some guests come surprisingly and some guests are usually invited, but guests have come to our home.
Yes.
So we have to, treat them well. We have to welcome them. We have to create that welcoming and positive.
This guest is someone who is the most special person.
Special
in your
person
life.
we will never at least want him or her to leave us.
So that is the importance, no? So if the guests are always welcome, this is a new life which is being created within us. So very, very important for us to have a clear intent, then a perfect start, then a perfect prenatal bond, and automatically that is going to continue even after birth till the child is going to be alive with us.
So we have to have a physical clarity, a mental clarity, an emotional clarity to have our baby with us.